Thank you so much for watching NTV News this morning. I am Penina Karibe. Have a wonderful day. Misiko Andere is now ready for you. Misiko.
Hi Penina, how are you?
I'm great.
It's unfortunate that your news guest couldn't make it today.
Oh yeah, I wonder what happened.
Well, you know, some things are unavoidable.
I'm
some
sure,
things,
yeah.
Maybe we can get him on tomorrow.
We can talk to him, by the way.
Yes, excellent. Today on Lifestyle, we're talking about asthma. You know, some people have it when they're young, some people have it when they're old. What are the causes? How do you treat it? So that's what we're going to be talking about in our Healthy Living segment.
Oh, great. Interesting.
Asthma can be a worrying condition no matter what age. For asthma sufferers, oxygen and airflow through the lungs can make the difference between life and death.
Asthma is an inflammatory disorder of the airways which causes attacks of wheezing, shortness of breath, chest tightness and coughing. Asthma is caused by inflammation in the airways. When an asthma attack occurs, the muscles surrounding the airways become tight and the lining of the air passages swell. This reduces the amount of air that can pass by and can lead to wheezing sounds. Nturibi is a pregnant woman who has lived with asthma all her life.
Asthma is something you're born with. So after like 1 year onwards, I had different allergies. It's basically an allergy, kind of like a disease that's because of an allergy. So from 1 year onwards, I had asthma.
It is important to recognize potential asthma triggers in the indoor environment and reduce your exposure to those triggers. Some of the most common indoor asthma triggers include secondhand smoke, dust mites, mold, cockroaches and other pests, household pets, and combustion byproducts.
When you're given an inhaler, you can control the symptoms way before it becomes serious. The worst feeling you can ever have. You feel like you're suffocating.
She is one of the lucky few whose asthma attacks have reduced considerably, and although her unborn baby faces the risk of asthma, so far she's registering a healthy growth. Nkara is a young asthma patient who has just been diagnosed with the disease.
We discovered it about, maybe I can say 3 to 4 months ago, because what happened the first time is she had a cough. Okay, she'd keep on getting colds and coughs, and when we went to see the doctor, when he listened to her chest, he said, well, do you have family history of asthma? And I was like, yes, there is. Then he's like, she needs to be nebulized because her chest, she's already having the tightening, the one that leads to the wheezing.
Asthma is not treatable, but patients can manage it and still live an active life.
As parents, we need to encourage our children to take part in, just to live life. Of course, not to live life like there is no asthma, but you can still live life knowing that I have this problem, but it can be controlled.
From these two shining examples, it is clear that one can pursue their dreams, whatever they might be. But it is advisable that no matter the infrequency of the attacks, always carry an inhaler with you. Remember, it is all about managing and controlling the disease.
In studio to help us understand asthma is Dr. Dennis Nturibi. Thank you very much for coming to studio to talk to us.
You're welcome.
Asthma, very common disease among old and young. Maybe you can tell us what asthma exactly, what it is.
Well, asthma describes a condition whereby an individual's airways get irritated by various elements from the environment or also superficial elements. And what happens is the air pipes get irritated, and then they react, and you find that the smooth muscle around the air pipes goes into hyperactivity and the air pipes constrict. This individual also has a lot of mucus production, yes. And this mucus clogs up the lungs. So what you get is called an asthmatic attack, whereby suddenly someone can't breathe. They're finding it very difficult to pull in and push out air, and they feel like whatever they do, they're actually not getting enough.
Okay,
and
just getting into the symptoms. Let's talk in detail about the symptoms of an asthmatic attack, whether you're 10, whether you're 50. What are the symptoms?
They'll usually be very similar, and you'll find that what the main symptom is wheezing. Because the airways are tight, someone has this kind of sound. Then after a while, they start coughing in an effort to bring out the mucus they have in their chest. Now, sometimes you have other symptoms as well. Someone is trying to use their whole chest to breathe in. You know, breathing is usually so easy. We don't think about it. But for an asthmatic, you find they're struggling and they're trying to use all the various muscles of the chest to force that air in. Okay.
Is it painful?
It's not painful, but it is very stressful and makes you very anxious.
Right. Okay. How then do you relieve this restriction in terms of medication and in terms of exercise to help you relieve that medication, that restriction?
Usually it's medication. In the acute stage, we talk of medication. You'll take some medications that reverse the process, so they cause smooth muscle relaxation. So if the airways were tight, then they are able to become untight or to relax. Now after that happens, then the mucus is able to come out and someone is actually able to naturally cough out that mucus. And that is for the relief of an acute asthmatic attack.
Okay. Is asthmatic hereditary? Because this seems to be like an internal disease. Is it hereditary?
Asthma has an hereditary component, because you find that it tends to run in families. So if someone from your ancestral line was asthmatic, someone down the line will tend to be asthmatic. But there is also asthma developing in people whose family did not have asthma. So it's not very well understood. There's been some definite genetic components, but there's also non-genetic component as well.
As a pregnant mother, are you able to tell that your kid is asthmatic when you go to the doctor, or can it be diagnosed before the child is born so you can take it? You can't?
No, it cannot be diagnosed before a
child. So if it's
born.
hereditary, you prepare yourself psychologically that your child might have asthma.
I don't think there's justification in worrying about it so much to that extent, because you can't really predict who will end up having asthma and who will not. Then also the severity matters. Asthma can be very mild, it can be very severe. So as a pregnant lady waiting to have your first child, I don't think you want to worry about that.
You just worry about your baby and you're okay.
Yes.
Let's talk a bit about asthma at different ages. You've talked about you can get asthma at the age of 20, 30. How severe is it when you have it as a child, or when you have it in your mid-teens or in your mid-50s?
Asthma is commonest in young children below teenage, and it is very common in girls at that age. Now, as half of this, as they get to their teenagehood, will sort of outgrow their symptoms, but again it can recur later at young adulthood. Of course, in children it's a bit worrying, because the child is not going to be actively involved in the management or the treatment of their asthma. An adult is someone who understands, knows what danger signs to watch out for, that kind of thing. Severity, it can be severe in any age group. Okay, but we know a lot of asthma tends to happen in the very young and again in the very old.
Can you have asthma for life?
Yes, you can have asthma for life.
So you'll be on medication for life?
Yes, you'll be on medication for life. There are some people who will always have an element of airway hyperresponsiveness, and basically that's what asthma is. And medications are given for the acute stage when you have an asthmatic attack, but for some of these individuals who have severe asthma, we also want to give them a preventer medication or a protective medication like the inhaled steroids, so that instead of having an attack every week or twice a week, maybe they have an attack once in 2 or 3 months. Then their quality of life is able to improve. They're able to engage in the usual activities that they would not be able to engage in.
Okay, I see you brought some gadgets or tools for us to look at. Maybe you can start with the first one and tell us what it does and how you prescribe it as a doctor.
Well, the commonest gadget used for the treatment of asthma is an inhaler, a Ventolin inhaler, and this is it. And it comes with a canister and a delivery system. Now, when you have an acute attack, you use Ventolin inhaler, and there is an art to using this thing. So I would advise every patient to go and see their doctor and learn how to use the inhaler. Now, we have what is called a spacer. A spacer makes the art to using this thing much simpler. And for an adult, this is what we call the spacer. It's basically a canister. You put the inhaler on this end. Again, remember to shake your inhaler. Once you put it in, you put this into your mouth and you pump in and you take 7 to 10 breaths. This ensures that the medication gets to the right place and in the right dosage. Now, direct use of an inhaler like this, a lot of people tend to misuse it or use it incorrectly, and the medication does not get to the right place. Now, in the case of an asthmatic attack or an oncoming acute asthmatic attack, that can be a very dangerous thing because you want to stop it early and not late. Now, for children less than 4 years, of course, you are not going to teach them how to inhale. So we have what is called a baby spacer or a baby haler. It's the same principle. It's a spacer. It looks very elaborate, but all it is a long tube whereby you put your inhaler on one side, and this goes over the nose and the mouth of the baby. And you put in your medication, and the child, you time 7 to 10 breaths. And this is very effective in ensuring that your asthmatic child, who of course has not yet learned how to use an inhaler, can get the medication. Now, both spacers can be used for Ventolin inhalers, which will give relief in an acute episode. They can also be used for steroid inhalers, which are used for the long-term treatment and control of asthma. A different kind of inhaler called an AccuHaler is this circular thing.
It looks like a toy.
It looks like a toy, so of course can be very attractive to the children. And it's opened, the medication is inside. Okay, so you pump the medicine and suck it in. Now, the medication in this canister is in the form of a powder, and it is said that the fine powders are able to reach deeper into the lung. This is in the form of an aerosolized mist. Okay, and basically that's the difference, an evohaler and an AccuHaler. Now, when we come to diagnosing asthma in the emergency room, you come in, you're asthmatic, and you're saying you're having problems in breathing. We're going to use what is called a peak flow meter. And basically this has a graded system from 60 to about 800, and you blow into the gadget, and this tells us the capacity of your lung, and if you're having an asthmatic attack or other conditions that are similar to an asthmatic attack, then the rise of this meter is going to be lower than it should be. Now, the taller you are, the higher your peak flow.